ask you, Ibu Indri. I know that the first panel has already touched on the omnibus law, which seems to be very, very popular. The regulation and policy is everyone's, desire to understand, I guess. I'm sorry, guys. And the question is, the Ministry of Health is committed to supporting health innovation through regulatory frameworks such as Health Omnibus Law and the Precision Medicine Initiative to combat diseases. Now the question is, can you elaborate on how these regulations are fostering innovation in medical equipment and also the biotechnology sector? And what kind of impact do you see they will have on healthcare delivery in Indonesia?
Okay, so thank you for the questions. So I think the previous panels already told us about how impactful is the omnibus law, but I think here I will be focusing more on the precision medicine. So I think Ministry of Health already done a lot regarding to, because we would like to have the better quality services to community with the approach of the precision medicine. So one of the steps that Ministry of Health did is that we issued the new initiative called the Biomedical Genome Science Initiative. So we know that at the moment, most of the drugs, most of the medications, like the medical devices, diagnostic, is all based on Caucasian populations. But basically what we have now, we have enormous population, 280 million. So why don't we have the data from our own population? So therefore, the BGSI came. So what we are doing now, we are developing in two sides, so from the hospitals and also from the central in the BGSI centrals. So we have 10 hubs. So we have 10 hubs, which is 10 vertical hospital with their own center of excellence. So for example, Dharma is for the cancer, and then Rumah Sakit Pon for the stroke, and then for the cardiovascular, we have Rumah Sakit Jantung Harapan Kita. And then for the maternal and health and baby, we have the RSAB Harapan Kita. And then also for the diabetes and the metabolic diseases, we have the RSJN. So those are 9 hospitals that have their own center of excellence. So now they are developing the targeted sequencing. So I think we can see from Ibu Santi's videos that how we can screen the cancer earlier, then the higher that the cancer can be cured is also it's going to be higher. So therefore, we support our hospitals so they can do the test based on genomics for those kind of diseases, so they can give the treatment precise based on the result from the genomics test. That's the first one. And the second one is about the clinical research center. So as you know that compared to other countries in Asia, that Indonesia is quite low for the clinical trials, right? This is because of the very complicated regulations, and we also have the material transport agreement that which is, I think, it's still one of the obstacles that the CRO or the sponsor have from overseas. But however, what we do is that now we simplify the process of the material transfer agreement. Now we are currently on the transforming the MTA committee. So before we don't have the certain time, the timeline, whatsoever. You name it, you don't know when your submission is, and then in which step you are. But now we are in developing on that system, and also for the clinical research center that we are as the facilitators, we are the matchmakers. So the Ministry of Health has the clinical research center, and we have the clinical research units in all hospitals. So for now, we are focuses on 37 hospitals, vertical hospitals under the Ministry of Health. But of course, we are also inviting all hospitals in Indonesia, private and also owned by the district, to join us. So later on, we will, because we don't have the analysis, we don't have the gap analysis. So what the hospital does, what the hospital have, what that need to be enhanced. So therefore, I think early next month, we will have the survey, the questionnaire that will be distributed to all hospitals about the capacity of the infrastructure as well as the human resources to do the clinical research and also the clinical trial. So I hope all hospitals will be joining on that survey. So therefore, we will have the gap analysis of the clinical research unit in Indonesia. And then for the precision medicine, I think, and now we currently have 2 services in Rumah Sakit Kanker Darmais and also in Rumah Sakit Harapan Kita. So in Rumah Sakit Kanker Darmais, we have the test called the eye care. So the eye care is can detect the screening 113 genes for the cancer. And of course, for the genomics, it's very, we need to be very careful because of the data, right? So therefore, what we have is that we collect the sample from all the hospitals, and then the hospital will do the targeted sequencing, and then we have their own biobank, and the rest of the sample will be sent to us, and then we will do the whole genome sequencing. And of course, for that, we anonymize everything. So everything is already based on the ethical, because like we get the ethical approvals, and our informed consent is also tier informed consents, which is they have the option to opt in or opt out whenever they can. For example, that okay, so if you want to join with our study, okay, yes, but then you want to give me your blood, yes, but then no, I don't want to share my data. Then you can check no on the share the data, So all is hopefully there, because now we have the regulation for the private data, right? So we have to be careful with that. And then the samples that we'll send to the BGSS Central, so we will have the whole genome sequencing, and then we will have the database for the genomics data for Indonesia. And it's not belong to Ministry of Health. So this is what the roles of the BGSI. So we are an enabler. So we invite all of you guys to use the data. Of course, we have the system. So you guys have to send us the proposal. We will review that. Basically, we replicate what the UK Biobank does. But the UK Biobank is more private, right? But we are more to the public services. So there will be certain system that we will have. So the aim is that the ecosystem will increase, like they will use the data, and they don't need to do the data collection. They can use the data, and they can develop the medicine, the treatment, as well the medical devices that based on Indonesian populations.
Thank you, Dr. Thank you, Windri, for that amazing explanation, and it opens doors for everyone here to realize what the program is and the incentives, the regulation that has already been built, and you can approach her maybe to ask more questions.